Hi, everyone. My name is Molly Wilkinson, and I'm excited to be the April guest speaker for the SDSU Women's Resource Center. April is Sexual Assault Awareness Month, so today I will be talking about how to prevent and deal with this. If you have any questions after my talk, please feel free to email me. I'm always happy to chat. So who am I? I am finishing up my 5th year in the Clinical Psychology Joint Doctoral Program here at SDSU and also at UCSD. In this program, I am in the neuropsychology track, meaning I focus on brain-behavior relationships in the context of psychological disorders, and I'm completing an emphasis in child and adolescent psychopathology, which means that my research and clinical expertise falls within this specific demographic, such as diagnosing and treating children and teens. My research experience as part of my time in the doctoral program has been at the Brain Development Imaging Labs at SDSU. And in this lab, I assist with and conduct research on individuals ranging from toddlers all the way up to 70 years old. And these individuals have autism spectrum disorder, and we conduct research using neuroimaging, so things like MRI, and neuropsychological assessments like IQ tests, memory tests, and a whole bunch of different cognitive tests. My clinical experiences as part of my doctoral program experience have been at various clinics within Rady Children's Hospital and at UCSD. I have experienced diagnosing and treating many childhood disorders such as autism, ADHD, things like learning disorders, and then also more mood-based disorders like depression, anxiety, PTSD, and some behavioral disorders like oppositional defiant disorder and also tic disorder. Some additional areas of interest of mine include teaching. I have taught multiple semesters at SDSU for the undergraduate course Developmental Psychopathology. I also volunteer as a mentor through 2 different programs which focus on mentoring underrepresented, diverse, and low-income individuals who are wanting to apply to graduate school. So if this applies to you, I highly recommend looking into Project Short and the APA Division 53 mentoring programs. They are free to sign up for, so if you think you will be going on to any type of graduate program and would like some advice and mentorship, I would check those out. And lastly, I'm also an executive function coach and general tutor for middle school and high school students throughout San Diego. Who I am not a mother. I figured I would address this as I understand this talk is geared towards parents who are students at SDSU. So everything I talk about today is based on scientific research and my clinical experiences as a therapist. So before we get into sexual assault, I want us to think about what makes a healthy family. This will be the foundation for preventing sexual abuse as much as we can. Of course, it is not entirely preventable, but there are family values and expectations that research shows lessen the risk of child abuse. I encourage you to pause the video at this point and consider the following. 1, what makes a healthy family? What types of environments provide the child the greatest opportunities and safety? And lastly, what types of role models help a child develop into a healthy individual? So you can take a moment now, think about these questions, and start the video when you're ready to come back. Okay, I hope you're able to spend some time thinking about those questions and how you think they fit maybe into your life. So psychologists have found that healthy families have some of these common traits. Healthy families have knowledge of child development, so what is expected for different ages. They have adequate coping skills, so if a child is upset, angry, anxious, are parents able to help them in the moment? Can they teach them how to build these skills so that they are okay coping themselves? Healthy families also understand ways to enhance child development. So how do we keep pushing children to advance to that next developmental level? They also have appropriate parent-child attachment and communication. So does the child feel secure in their attachment with the parent? Do they know that the parent will be there to support them when they need it? And are parents and children able to have productive, positive conversations? And lastly, research shows that healthy families have expectable environments. So, an expectable environment is an environment where there are protective and nurturing adults, and these adults are available to the child or the children in the family. The child and children know that the parent will be there to protect them and to be there for safety to make them feel good. An expectable environment also has opportunities for the child to socialize and build up their social emotional skills, whether that's with other parents and children in the family, or the family is able to bring their child out into opportunities in the world where they are able to practice socializing. And additionally, there are also opportunities to learn and explore. Again, that relates to ways to enhance the child's development. We want to continue pushing the child forward onto those next developmental levels. So one of those points that demonstrate what a healthy family is talking about adequate coping skills. So how do we foster a child's coping skills? They definitely don't just come out knowing, okay, I'm sad right now, so maybe I'm going to take some deep breaths and do something that makes me feel happy. They need to learn how to do these things. So we want to encourage kids to talk about their feelings. Being able to verbalize an emotion reduces the likelihood of it resulting in problematic behavior. Young kids don't always have the vocabulary to express how they're feeling, so their response is more physical. They cry, they scream, they throw things, they hit people. They need those protective and nurturing adults within that expectable environment to teach them how to express themselves. So as a parent, you can model emotion words like, I feel loved when you make me drawings at school. You can also model them in other types of emotions, pointing out what makes you feel sad, what makes you feel frightened, what makes you feel brave. Just modeling these in your everyday life, your child will learn and expand their vocabulary. And instead of just relying on words like happy and sad, they have an expansive vocabulary to pull from so that they can express themselves appropriately and learn that talking it out will be better than those more physical reactions. At the same time as we are building that strong emotional foundation, we want to teach children about body safety. So I'm not going to read through all 10 of these just for the sake of time, but please take a look at this picture when you have time later on, which lists out many safety rules. So these are things like teaching children the correct name for body parts instead of using childish names. We can also explain to them that body parts are everything that goes under our bathing suit, so that's more easy for them to understand. And that talking to them about how no one should touch these private parts, nor should they touch or see another person's private parts. Of course, these body safety rules are for young kids. So we will get into how to approach these differently at each stage, especially as they get into those preteen years. So on the slide here is another picture of a couple body safety rules. Some of these overlap with ones on the previous slide. This one is just a bit more child friendly. So if you have a young child, this can easily be shown to them and used to start these conversations. So children should understand from a very young age that their body belongs to them. They should also work with a parent to develop a safety net of 5 trusted adults that they know they can talk to about anything. This relates to the body safety rule about secrets. So if the child experiences something that has made them uncomfortable, teach them that they should always speak up. This is, again, pulling from that emotional language. They can start to learn these words: uncomfortable, anxious. And when they feel these things, understanding that they can go to those adults in their safety network. It is okay to talk to them about these types of things. Children should also learn about early warning signs. So these are warning signs in their body that tell them something is not okay. These are physical signs like a racing heart, stomach ache, feeling shaky, a headache. And this, we can teach them, this means that they're maybe uncomfortable, they're anxious, they're upset. And it is more easy for really young children to understand what's going on physically than emotionally. So teaching them these early warning signs, of course, paired with that emotional language, helps them know, okay, maybe something is not right. So this video here animates the 5 body safety rules. I encourage you to use this video and the previous pictures as a launching point for conversations with your young child. You can watch it here. Again, it's just a fun little video that kind of animates this and allows you to start the conversation.
My body safety rules. 1. My body is my body and it belongs to me. I can say no if I don't want to kiss or hug someone. I can give them a high five, shake their hand, or blow them a kiss. I am the boss of my body and what I say goes. 2. I have a safety network. Every person's safety network will be different. These are the adults I trust. I can tell these people anything and they will believe me. If I feel worried, scared, or unsure, I can tell someone on my safety network how I am feeling and why I feel this way. 3. Early warning signs. If I feel frightened or unsafe, I may sweat a lot, get a sick tummy, become shaky, and my heart might beat really fast. These feelings are called my early warning signs. If I feel this way about anything, I must tell an adult on my safety network straight away. 4. Private parts. My private parts are the parts of my body under my bathing suit. I always call my private parts by their correct names. No one can touch my private parts. No one can ask me to touch their private parts. And no one should show me pictures of private parts. If any of these things happen, I must tell a trusted adult on my safety network straight away. 5. Secrets. I should never keep secrets that make me feel bad or uncomfortable. If someone asks me to keep a secret that makes me feel bad or unsafe, I must tell an adult on my safety network straight away. My body is my body and it belongs to me.
All right, so now that we've talked a little bit about what builds that strong, healthy foundation for building up these types of families where the child is comfortable and has this strong emotional and physical well-being, I want us to take a moment and think about how you personally can help develop your own child's emotional and physical well-being. How can you start to model using emotion words and teaching them coping skills? How can you develop appropriate communication with your child and foster that secure attachment? How will you introduce body safety rules? Will you choose to use one of these posters, the video, or maybe a conversation? Who can be in your child's safety network if you haven't already developed one? Take some time now to pause the video and think about how you can apply these things to your family. Okay, so hopefully you are able to think about how you can start to apply these topics to your family. Now we're going to get into specifically what you can talk about with your child and at what age. Sometimes it's hard to know when a child is mature enough to understand certain topics, especially about body and sexual safety. The following slides provide some examples of what a child can start to understand at various ages. And again, of course, these tables are just estimates. So maybe if your child, is maybe a little bit more mature than their age, maybe you take some information from another table, or you think maybe they're a little bit less mature than other kids their age. So again, these can be tailored to your own child. It's just suggestions. So when we're thinking about children in the toddler age range, so typically under 4 years old, parents can start to talk about basic body and sexual information. Boys and girls are different. That's a fact. They can just start to understand that maybe they're going to look and feel differently than people of the opposite gender or sex. They also have different body parts, and these are what we should call them. You can start to talk about personal boundaries, such as body safety rules, using that video or the pictures, and letting them know that no one can touch their private parts, and that in general, they can always say no to being touched regardless. If they're not comfortable giving a hug, a high five, things like that. This is also when you start to talk to them about what they can do if something not okay happens. Like who should you go to? What is not okay behavior? They can go to people in their safety network, things about those, they'll start to experience those early warning signs and things like that. Jumping to our kindergartners, so around 4 to 6 years old, you can continue to expand on similar topics, but with a bit more developmentally appropriate information for these kids. So in general, children are curious. We all are. They will find out about these different things, especially when they start to learn about their bodies. It's best that this knowledge comes from a parent or a trusted adult. They're going to talk about these things regardless. So if they are coming from an adult or a parent, at least you know you can give them the truth, right? They don't have to be wondering about these things, finding out about their topics that they're curious about inappropriately. Different safety topics that you can start to touch on around this age is defining sexual abuse, which I know sounds scary. Oh my gosh, my 4-year-old should not even know the word sexual abuse. This should not even happen to them. It won't happen to them. We will get into it in a couple slides about what you can start to talk about sexual abuse. You can also start to talk about stranger danger. This is when kids are starting school, going to preschool, going to kindergarten. They're going to be around more adults. So learning about stranger danger will be really important. And again, reminding them what to do if they are in a not okay situation. And lastly, we have our older children to adolescents who are approaching puberty themselves. So this is a good time to talk about these body changes. In the adolescent age range, kids will be spending more time online, so safety information can be tailored specifically to that. Middle school, maybe when people start to get into relationships. Of course, these are typically very simple, minimal relationships, but it's best to talk about these experiences and how to maintain boundaries before something bad happens rather than after. So in addition to that information, here are 2 pictures that are a bit more child-friendly. If you visit the website, which is linked here, you are able to download and print all of these posters, as well as the ones that I showed earlier. And there's a whole bunch more on this website, all for free. On the left, we have a poster depicting body safety conversation topics from 0 to 6-year-old, which very much goes over to what I was talking about on those previous slides, and even gives you specific topics that you can start to address. And then on a right is a poster about determining if an adolescent or at least an older child is in an unsafe relationship. So this goes well with talking about dating, as I mentioned on the previous slide. And again, it is always better to address these topics earlier so that we can try to prevent them and provide our children education about these topics before it's too late. So I want you guys to think about what is appropriate for you to teach your child or your children right now based on their age and what we just talked about on the previous slides. What safety information should they start to understand? What body and sexual information is appropriate for their age? So take some time, pause the video, apply your knowledge in the moment, and come back when you're ready. Okay, so welcome back. Hopefully you're able to think about how old your child is and what they should know at their age. So now that we've started to think about what is appropriate for children to learn, and again, that healthy family foundation, I want us to get into, let's say, the more scarier part of this talk. So here I'm going to start talking about different kinds of sexual misconduct. I'm going to be talking about these in detail. We're going to talk about facts. We're going to talk about myths. We're going to talk about defining these types of things. So if this topic is triggering to you, I just want to set out a warning that I will be getting into more detail beyond this slide. So if you prefer to scroll through and kind of give yourself a preview before jumping into this, I encourage you to do that. So there are 3 types of sexual misconduct. Sexual harassment is a broad term. This refers to all physical and verbal acts. This is any kind of unwanted sexual advances, comments, jokes, touching, etc. Sexual assault is a bit more specific. So this is only about physical acts. So again, we have sexual harassment as our broader umbrella term, and right under there is sexual assault, defining just those physical acts. Unwanted kissing, touching, groping, forcing individuals to perform sexual acts. And lastly, even under sexual assault, we have sexual abuse. So this term is specifically used to define sexual assault against children. So any type of sexual activity with a child will fall under sexual abuse. And just as a reminder, any type of act is a criminal offense, and child here is defined as anyone under the age of 18. So now that we know a little bit about what sexual abuse is, again, those sexual assaults acts that relate to children, let's consider some common thoughts about it. I want you to take a minute to pause the video and consider if the following are true or false. 1, sexual abuse is a rare experience. 2, a child is most likely to be sexually abused by a stranger. 3, preschoolers do not need to learn about sexual abuse and would be scared if they learned about it. 4, children who are sexually abused will never recover and always grow up to be sexual offenders. 5, child sexual abuse is always perpetrated by adults. 6, talking about sexual abuse with a child who has experienced it will only make things worse. Okay, so if you haven't taken a moment to think about these things, you can think about them now, because on the next slide, I will reveal the answers. Okay, so 1, sexual abuse is a rare experience. False. We'll get a little bit more into that in the specific numbers on the next slide, but this is a common misconception that is actually false. A child is most likely to be sexually abused by a stranger. Again, this is false. 95% of children are abused from someone they know. 3, preschoolers do not need to learn about sexual abuse and would be scared if they learned about it. Again, false. You can talk to your child in ways that are appropriate at all different developmental stages. 4, children who are sexually abused will never recover and find themselves in poor relationships. False. Children are pretty resilient, and many recover if the necessary support is given. We will get into what that necessary support is. Child sexual abuse is always perpetrated by adults. False. 23% of reported child abusers are under 18 themselves. And 6, talking about sexual abuse with a child who has experienced it will only make things worse. False. Talking about it in a healthy way can actually minimize the physical, emotional, and social problems and difficulties that usually occur after a sexual assault happens. Okay, so let's get into some fast facts about sexual abuse. Like I said on the previous slide, sexual abuse is not a rare experience. 1 in 4 girls and 1 in 6 boys are sexually abused before they turn 18. It is estimated that 85% of children never report their abuse. What might be surprising to some is that 30 to 40% of children are abused by a family member, And in general, like I said previously, 95% of children know their abuser. So there's of course a big push on stranger danger for children. I mean, I even mentioned that at the beginning of this talk. It doesn't mean it's not important, but children should be aware that strangers, they're not the only ones that can harm them. If we pose it as such, only strangers are dangerous. If there's a stranger around you, run. If they try to do anything, yell, scream. If we pose it as just within this context, strangers are dangerous, without considering talking about how people they know can hurt them, like family, friend, neighbor, then they might not view any abuse that they experience as harmful or wrong because, hey, my neighbor isn't a stranger. So just consider that. Of course, stranger danger is important, but again, anyone can harm us. So how do we know if a child has been sexually abused? A lot of the time, children are hesitant to reveal this information. This is why it is very important to consider what I talked about at the beginning of this talk, building the foundation of a healthy family from young ages so that children feel comfortable talking with the parent about uncomfortable topics. Starting them young talking about these things will make it easier. But if a child has not revealed this information, these are some things to look out for. So in young children, we are looking for signs such as children who are overly interested in theirs or others' genitals, talking about them, touching them, incorporating sex play with another child. So again, these children typically should not have been exposed to these experiences, but we start to wonder, how do they know about how sex works? They might engage in sexualized play with dolls and toys, and also different drawings relating to this. We're looking out for children who are repeatedly not wanting to go to a certain place or activity with really no reasonable explanation for it. Children start to become more secretive, even sometimes hinting towards a parent because they want to kind of test the water, like, oh, I have a secret that you don't know. And again, like many of these things that I've talked about, like I said earlier, children are curious. Children are also secretive. Once they learn about secrets, they're like, oh, I want to have that. That's mine. But again, that's why we go back to those topics that I talked about at the beginning. Talking about secrets that make us uncomfortable should be shared with other people. They also start to get more withdrawn or anxious as well. Another sign that we typically see in children who have been sexually abused is insisting that they go to bed fully clothed and that this is a change from previous. So usually they're okay changing into pajamas or wearing just a diaper. We also typically see a regression in their behavior. So children who are fully potty trained have started to wet their bed again, or even wetting themselves during the day. And a lot of the times we will see them regress towards a baby voice. And lastly, we're also looking for any unusual bruising or bleeding in the genital area, around the butt, lower stomach, and thighs. In adolescence, we can also see very similar things that we see in children, especially the bruising, not wanting to go certain places, becoming withdrawn. But we also see additional information additional symptoms such as self-destructive behavior, engaging in drug use, suicidal ideation, self-harm, teen pregnancy. We also start to see them refusing to attend school. That may be because their abuser is at school, whether it be another teen or a teacher or a staff member, or because they're not feeling well about themselves. We'll also hear teens describe their body as dirty, ruined, or damaged if they've experienced sexual abuse. We also see a lot of eating disorders start to come up after the sexual abuse. There's persistent running away from home. We also see, again, like in children, start to withdraw and also anger. And lastly, we also see in adolescents, they start to use sexually aggressive terms in conversation. So after hearing about how sexual behaviors can be a warning sign for sexual abuse, like I just listed to you on the previous slide, you might be like, wait, hold up. Children often do engage in sexual behavior that is developmentally appropriate for their age. I know this, but I know that it's confusing to depict, okay, what is developmentally appropriate? And how do I know if it could be a sign of sexual abuse? So in preschoolers, these are things that are developmentally appropriate. We would expect a child to start to realize at this age that they have private parts, especially if you start to have these conversations with them early on. In general, they're realizing they have a body. They can control it. It's cool. I can throw things. I can build things. I can eat things. In general, they're exploring. They're also very immature compared to older kids. So pants might come down. They might try to touch someone else. It's important to consider when these young children do this, they typically think these things are funny. They do not intend harm when they do this. And same with peeking under bathroom stalls or using potty language. Again, we would expect these things, but when you're drawing the line between could it be a warning sign that sexual abuse happened and what is appropriate is thinking about their intent, right? Are they still finding this funny because they are 3, 4 years old and taking down your pants is funny at that age? Or is it coming out of nowhere and they don't seem to be kind of laughing or using this as a joke? When we get into those kindergartners, we would expect them to mature a bit. So they might continue to touch themselves again in that harmless explorative behavior. They might look under bathroom stalls or open a door on someone changing in a silly, non-harmful way. And when these things do happen, again, they are developmentally appropriate, but it's a good time to prompt the conversation about body safety, boundaries, and how to respect yourself and others. For our older children to adolescents, they should now kind of stop touching themselves in public at this point. They should understand that this is inappropriate. However, they're going to be interested in more advanced things. I know what my body looks like, but I wonder what the other gender looks like. They're also going through puberty and hormonal and body changes. So again, children and teens are curious. They want to know things. They'll have questions about these things. Everyone has a tablet, a phone. They have a friend who knows more than them about things. It's best this knowledge comes from a parent before anything bad happens, so you can ensure that they are getting the correct information. There's a whole lot of false information out there, and we want to prevent the children and teens from getting this information. Also, modeling that talking about these things with a parent, having questions, being curious, it's okay. And kind of modeling, we can have these types of conversations that will allow your relationship to be stronger and more open. So you can talk about those topics all day long with your kids, but there's also some actionable things that you can do that go beyond just having a conversation. One thing to start with your child when they are young is to have a warning word. So this can be a word that would be infrequently used if a child was at a play day, a sleepover, summer camp, somewhere like that without you. That way, if the child calls their parent in front of an adult, they can work this word into a sentence in a non-suspicious way. If your child is very young, you could even practice that sentence with them. Like, our family word is going to be carrots. So that's typically not something that's coming up in conversation. So if your child maybe says on the phone, practice with them, hey, mom, I really want you to get carrots from the store, then you know that something is wrong and they need to be picked up immediately. Another thing you can practice is dealing with consent. Role play with your child situations where they would and wouldn't give consent. What would you say if your camp counselor wanted to give you a hug, but you didn't want that? Practice with lots of different situations so that they are comfortable giving or not giving consent. And there's a bunch of options here on what they can say. They can say, no, I don't want to, I don't like that. And they can also say, yeah, I want to do this. Absolutely. You can also teach them how to stay calm in these situations. So maybe they feel like they should give that hug to a camp counselor and they start to get nervous. So teaching them these skills practicing exactly how to give and not to give consent will make them more and more comfortable. On the other hand, we also want children to know that they aren't the only ones with body safety rules, but that everyone has these rules. So before a child does something personal, such as maybe giving a hug, make sure to teach them to ask. Now they need to ask for consent instead of being the one giving it. So that way they will learn to respect not only themselves, but also others. So consider how you can start to incorporate these ideas into your family. How can you teach your child about a family warning word? How can you help your child learn about and practice consent? Take a moment to pause the video and we will join when you're done. Okay, so sexual abuse is one of the many adverse childhood experiences that have been studied. Adverse childhood experiences, or ACEs, are potentially traumatic events that occur from birth to 17 years. ACEs include things like experiencing violence, abuse, or neglect, witnessing violence, or things like dealing with instability due to parental separation or inconsistent caregiving. Research has shown that ACEs are linked to chronic health problems, mental health disorders, and substance abuse in older teens and adults. So how do we prevent ACEs, and more specifically, sexual abuse? Focus on teaching children social emotional learning. Again, going back to those earlier topics that we discussed about modeling appropriate emotions, teaching them coping skills, respecting others. Also, educating parents in parenting skills and family well-being has also been found to prevent and reduce the impact of ACEs. And lastly, getting children involved in their community through mentorship programs, extracurriculars, religion, sports, anything that's going to get them into a hobby or an experience where they will have great mentors and be around other kids. Because again, if we go back to what is building that foundation for a healthy and safe family, we want to think about providing those experiences where they're building their social skills, they're learning, they're exploring, and they're moving up in those developmental levels. Okay, so I've talked a lot about building a healthy family foundation, what sexual abuse is, what it looks like, but that doesn't mean it won't happen to you, your family, or maybe a family you know. So if this does impact your child or a family you are close with, here's what you can do. 1, you can talk to your child in an open, supportive manner if you suspect, again, going back to those signs, that they might have been abused. They might be nervous to start the conversation. So again, just being supportive, being there for them without accusing them of anything. If your child does come and tell you, or someone else's child tells you that this has happened to them, it's really important that you believe the child's. A lot of the times, parents and family members will be shocked that this has happened to their child, because again, a common myth is that this is rare. Not many children experience this, which now we know is false. So it's important to believe the child. Tell them that they have done the right thing by telling you, and tell them that this is not their fault. A lot of times children believe that they have done something to cause this to happen to them. It's important to stay calm. Children see how you react to these things. So if you are getting extremely excited, obviously not excited, not in a good way, but just that your emotions are rising, they will recognize that and worry that they have done something to upset you. And make sure you don't pressure the child to keep talking. This may scare them and cause them to eventually withdraw. After you have gotten what you have from your child or the child that is telling you, and they are in a safe place, you should then go on to call and reach out. Call 911 if the child is in immediate danger. So another parent, another child told you that something is happening while your child is at camp, and your child is at camp right now, or school, or a neighbor's house. In an emergency situation, call 911. If the child is with you, call the National Sexual Assault Hotline. The number is here. You can also call or text the Child Help National Abuse Hotline. These are resources, people that you can reach out to. They're 24/7 hotlines that you can call, even if your child hasn't said anything and you believe or suspect something has happened. They will provide support and resources. And lastly, you can call the San Diego County Social Services. They have 2 numbers. They lead to the same place. You can call them here and let them know what has happened, and they will also provide you resources specific to this area. So what happens next? A lot of families are hesitant to engage in therapy. They might be worried about exposing their child to yet another adult, if an adult was someone who abused them. They might be scared that their child talking about these things will make them feel worse. Parents also worry that the therapist might blame them, especially if interfamilial sexual abuse happened, aka the child was abused by another family member. These are all common feelings, but they are not common experiences that families find once they start therapy. So what types of things happen in therapy for children who have been sexually abused? They'll work with a therapist to start to implement rules about body parts and sexual behaviors. They'll use parenting strategies to prevent and reduce sexual and other unwanted behaviors. They'll also address sexual education, again, going back to what is appropriate for that child to learn at that age. They'll support you in implementing abuse prevention strategies. Excuse me. How can we prevent this from happening again? They'll start to teach you how to enhance communication between yourself and your child. They'll also talk about privacy rules. Just because this happened doesn't mean that they can't, again, withdraw and have their own rules and consent. They'll start to teach them how to label and express their feelings. Once they know how to label those feelings, what can we do to regulate them? They'll also go over impulse control strategies and decision-making skills. Typically, we see these skills decline in children who have experienced sexual abuse. So we'll typically work on these in therapy. And lastly, we also see social skills being affected. Again, like we learned about what the signs are for both children and teens, social skills start to decline. They're starting to withdraw. They feel angry. Maybe they feel they can't trust anyone anymore. So we'll start to work on that as well. A specific type of therapy that treats trauma in general, and oftentimes this includes sexual abuse, is called trauma-focused cognitive behavioral therapy, or TFCBT. So in CBT in general, what we do is we teach individuals how their thoughts, feelings, and behavior are all connected. If I'm thinking that I'm sad, I'm probably going to feel sad and want to curl up in my bed in a comfy blanket. And that will result in me withdrawing, not hanging out with friends. And again, that will relate to my thoughts, again, back around that circle of maybe my friends don't want to hang out with me. I'm so lame. And this will just continue in this cycle. So in TFCBT, children and parents usually work with a therapist for about 15 to 20 sessions. It's a lot of psychoeducation about trauma and its impact on the mind and the body. We'll teach relaxation skills such as breathing. And we'll engage the child in gradual exposure to trauma memories. Once they are exposed to these memories, we'll go through some cognitive processing to address their guilt or self-blame, which is very common in these children. We'll also hold parent-child sessions to increase open communication, where the therapist is there to walk the parent and child through difficult conversations. And lastly, we'll work individually with the parent to help them with some parenting skills on how to manage any problematic child behavior that has resulted from this sexual abuse. I hope this presentation has been helpful. I know sexual abuse can be a scary topic and something no one ever wants to have happen to them or their child. But building a healthy family foundation and knowing the warning signs will lessen the risk of your child becoming a victim of child sexual abuse. Here are a couple more resources on this topic, so I encourage you to check them out. In addition, the links provided throughout the slides are accessible, and you can download your posters and different pictures from those links. And feel free to reach out with any questions. Thanks.